everyone, Rob Tolfrey. I'm a consultant in public health. I've got a few slides to talk through. I'm a bit on the fence of how to do this. I don't know if you have a view. So normally I like to keep this fairly informal and say, just stop me as you go. It's always difficult doing this remotely. I never quite know how much interest there's going to be. Clearly, we need to just manage that. And if it gets a bit overwhelming, then maybe I'll work through my slides. Just to let you know, there's only 10 slides. So if people have points of clarity or questions, do chip in. But if that feels a bit unmanageable, might just hold that to the end. And please do just shout if you're needing me to go a bit quicker. Really, the purpose of my update is just to do a bit of a where are we at the moment in terms of Lewes, and I will share my screen. And hopefully that will work. So we always have that awkward thing. Is that coming through?
It is, Rob, but you've got us on there somehow. Ah, yeah. There, gone. Excellent. Perfect. Thank you.
Okay, lovely. Now I can't see hands, so if you wouldn't mind just letting me know if someone's got their hands and introduce them.
Yeah. That's fine. Great. Thank you.
So the picture in Lewes is one that we're probably all familiar with in terms of what the national picture is. So just talking us back really from the peak that we had most recently around Christmas time. So our highest cases in Lewes were really just before and just after the new year. This was really a pattern that we had seen. It's an East Sussex story. It's really a southeast story that we saw a substantial rise in cases in November and December in Kent, and then in Hastings and Rother we saw in December a really sharp rise in cases. And Lewes, really, if you follow the East Sussex from east to west, Lewes was next in seeing this rise in cases, and we saw up to 150 cases in a day. So this just shows the number of new cases over time, with the dark blue line being the 7-day average. That was a lower number of cases than seen in the east of the patch, but still a lot more than we'd been seeing earlier on in the winter period. Those grey bars at the very end are the fact that the most recent 4 days or so are always subject to change because of lab processing times. But it looks like that picture of the national restrictions really having a good impact on bringing those number of cases down. But we're still seeing in Lewes around about 50 cases a day, and hopefully that will continue to fall. This psychedelic graph, I hope it's coming through on your screens okay. You'll see the dark blue line is Lewes. Really the large number of cases early on. So this is showing our 7-day rolling rate. You can see, if I use my cursor, Hastings was first to really see a drastic increase. This white dotted line is the national rates. So national rates fell by the sort of end of November, early December. Hastings suddenly started to increase drastically, followed by Rother, and you'll see that Lewes was further behind, but that sharp increase did happen. It was just a bit further delayed. And what we've seen most recently is actually Eastbourne being the area in East Sussex that has then gone the highest. And Lewes has really tracked about the average of East Sussex, and really you can see tracking quite similar to the national rate of new cases. This graph really, it plots all of the local authority tiers against each other, and you can see that Lewes at the moment is really in the middling of the country. Eastbourne actually quite high up. We see Brighton, and this is really showing all of the Sussex lower tier authorities and how do they compare nationally. Now this is something that we're particularly interested in, which is looking at how are our rates of cases in people over the age of 60. How does that compare to the rate of cases under the age of 60? And we see a broad pattern that's similar, and we've seen that over the last couple of months, that as rates have risen in the under 60s, it's been closely tracked by the over 60s, and here we can see in Lewes, towards the end of December, the rates in the under 60s shot up, and that was closely followed, although fortunately we didn't see quite the same spike in the over 60s. This is a map that's available, and I've got the links here. What I will do is have this circulated to you all. All the information that I'm talking through today is available. You sometimes have to dig a bit, but I provided the links for that. There's an interactive map that's published nationally, and we can see here that actually the pattern of infection across the southeast is broadly comparable. Now, if I compare this to when Kent initially went with this new variant in the end of November, we found that the far east was a dark colour, showing the fact that we had very high rates, and it was really visible how that was spreading across the southeast and northwards through London, through to the east of England. But we saw that in East Sussex. But where we're at now in terms of the southeast is that we've got a fairly similar level of infection, and that's really driven by the national restrictions, which is having a suppressing effect on the transmission locally. Here's another slide just showing some of those coastal areas having the higher rates, but this is zoomed out a bit further, and you can see a bit more variation when we zoom out at this level. Here we just look at the variation within the county at a bit closer, and again seeing rates in Seaford and Peacehaven having more pressures than elsewhere in the county, and that's something we have seen previously, that our urban areas and our coastal areas typically have been a bit more affected most recently. This slide, again, the psychedelic colours, similar colours or the same colours from before, but this is showing the testing rates. Again, the white dotted line here is showing the testing that happened, the testing rate nationally. And the good news is that right across East Sussex and in Lewes, we are seeing a higher rate of testing than we are seeing nationally. Perhaps unsurprising, given that we've had more infection locally than we have had nationally. The rates of testing in Lewes have been declining a bit, so Lewes is now the second lowest in the county, but those rates are gravitating towards the mean, really. But the good news, as I said, is they are above the England rate of testing. And what's happened to the positivity rate? This is something that we look at a lot, and is definitely a marker of is the situation escalating? And the good news is that the positivity rate is actually, so although we're testing more people than the national average, actually the positivity rate is a bit lower. It's around the 10% mark, and you'll see Lewes previously was up to almost 20%, but that has been declining. So that says that we're casting the net wide of those people who are tested, because we're wanting to see that lower positivity. If you're having a higher positivity, then that means you're not casting your net wide enough. Now, this is the really sobering graphic, which is showing the number of patients in hospital with COVID-19, and you can see, going back to May, in Esht, we had less than 100 on a single day in time, right down to a low in September, and even in November and early December, there were lower numbers, and this absolutely rocketed throughout December to the highs, which my colleagues online will be able to talk more to this, but really high numbers, up to just under 400 in a single day occupying a bed. And again, we can't talk about COVID without talking about the stark reality of the impact this has on deaths. This graphic is showing, and this is the most recent pull of this data, but if we were to pull this in a couple of weeks, some of this retrospective data would change. So this is showing, it's a bit of a clunky graph, but the black lines are the average deaths over the last 5 years, which is a bit of a marker of how many deaths roughly would we expect. And it fluctuates quite a bit because Lewes District has a smaller population, so we do get that greater variation. And you can see here the orange bars are deaths that were recorded where COVID wasn't listed as a cause of death, and blue where COVID was listed. And we can see that impact in the first wave, where we were seeing up to 18 people dying in a week where COVID was mentioned. And again, those numbers starting to increase again. Now, there's always a lag between rising infection and us seeing this ONS data, which talks about deaths. So no doubt if I was to be talking to this graph in a month or so, we will be seeing a different picture. Now, interesting in Hastings, the number of deaths from COVID in the first wave were sort of 0 or 1, and actually Lewes was more affected by COVID in terms of mortality. So far, the second wave hasn't shown the same sort of numbers, but we're still a bit too early to tell. Hastings, we're already seeing a much higher number of deaths compared to the first wave. I hope you haven't been asking questions and I've just been missing it, so I'll stop sharing my screen. I hope that's a helpful introduction to guide the conversation. As always, very happy to answer questions either now or as the meeting progresses, but hopefully that sets the scene a bit for where are we currently.
Thank you, Rob, very much. And it's deeply sobering, isn't it, everybody, to see not only the infection data, but also the number of deaths in our community. So it's very sad. And I guess some of us will know of people who in our communities who have died as a result of this virus. So thank you very much. So do people have questions? Yeah, Christina, I can see you've got a question.
Yes, thank you for a really interesting presentation, and thanks for sharing the slides with us afterwards. One thing I wanted to mention was that some people, they hear the figure, in Eastbourne it was 900 new infections in a week. They hear the word 900 and they see the slides tailing off and they think everything's okay. But if you actually have a look at the figures that tell you how many infections there are in an area, it's not okay. So in Eastbourne, for example, it's 1 in 17 people is infected. In Lewes, I think it's 1 in 23. And I think if people had that in their minds, they'd be very much more careful when they're out walking and when they're out shopping, you know, in the supermarket. Because if you go into a supermarket, the largest supermarkets have restricted to 200 odd people, but that's still 9 people who could be infected if you just statistically. Now, you'd like to think that most of them are at home and self-isolating, but this doesn't take account of all the people who don't know they're infected. So the chances are they balance out, and the chances are 1 in 20 odd people are infected in the Lewes District. And I just wonder if that's a statistic we should actually talk to the public about, so that they actually realise how much more careful they've got to be when they're out and about. Thank you.
Thanks, Christina. I mean, there's a couple of points there. I think, you know, you're absolutely right that there are different ways that we can talk through the story, and both over time, I think it's important that we tell the story a different way, because that can sing to people who, you know, we talk through statistics a lot, and actually different statistics resonate with different people. I think the number or the framing that you're using, Christina, is a helpful framing when thinking of, you know, what do we estimate of the potential number of people who may be infected at any one time. It's really quite difficult to do that at a local level, but absolutely agree with that principle of how do we keep the story fresh and live in a way that tells it accurately, but really helps people understand just why it's so important. And I think also the number of people in hospital, I think that tells such a powerful story as well. But you're right, we absolutely need to be changing the narrative so that it just keeps it fresh for people.
Thank you, Rob. Are there other questions of Rob? I've got a few, but are there others? So, Rob, one of the things that one of the questions that sometimes comes up is about do we have data on where transmission is occurring? So, is it in particular in our district? Is it in particular workplaces, particular settings? The data you presented about rates amongst those of working age and those not of working age presents some interesting questions, doesn't it, about is it essentially workplace related? And then also I think it might be useful just to cover off, and we can come back to it because we are going to talk about vaccination, but what are the public health messages that you want us as leaders, all of us, to be communicating over and over again to support you in the work that you're doing?
Sure, thanks. So a couple of points then. Firstly, we talk with the environmental health teams for each of the district borough each week, and we break down of the last week or the last fortnight, what is that pattern of infection? I think there's a couple of different groups that you can tease out. There's the gender divide, the sex divide, and we're seeing slightly more infection in women than men, but it's broadly comparable. The next question is the age groups, because that's a really useful marker of where may this infection be occurring. Are we seeing it in the 0 to 5s? Are we seeing it in school age, in university age, in working age adults? What I'm going to do is I'm going to see if I can pull up, but it will be a bit delayed, so you'll have to just bear with me, whether I can get the population pyramid just to bring up to talk through, because I think that would be helpful to show you. And we do look at that. Are there settings of relevance? And if we see any trends for settings, then the local environmental health teams are really excellent at promoting amongst that. So if pubs were open and we were seeing pubs being a bit of a driver of infection, then we can do that proactive messaging. So I will just sort of pause on that and say, if I can come back to you on the population pyramid, and I'll see what I'm sure I'll be able to get it before the end of the call.
Thank you.
On to the point about vaccinations, it's great news that we are seeing the vaccination being taken up. I think the messaging is about keeping it simple and really helping people to realise that we've obviously got the ordering that we're having to follow from the Joint Committee of vaccinations and immunisations on who those groups are. That's been scientifically driven, and we locally are following through those orders. Vaccine hesitancy is a big issue. It's been a big issue for a long time. To my mind, the only way that we respond to vaccine hesitancy is by having open conversations and listening to people's concerns, understanding where they come from, and realising that people have strongly held views for a range of different reasons, but often people just want the chance to talk through. Can I understand about safety? Can I understand about what are the component parts of the vaccine? I've got concerns around this or that or the other. So I think having the ability to have discussions, encouraging people. There are a lot of conversations that may end up being technical, and our GP colleagues are really well versed in having those conversations to really unpack what are people's concerns, and recognising that whilst from our perspective the vaccine is a wonderful opportunity, we're not able to win hearts and minds without having open and honest dialogue with people. So I would encourage people to have open conversations and to be able to provide challenge, but realising that it's something that needs to be unpacked, and that different messaging for different groups is also important. But I hope that we can all use channels to echo the general messaging that the comms teams are pushing around vaccinations. But I think conversations on individual basis are just really important.
Thank you. While you're finding the pyramid, or during the Patrick, did you have a question for Rob or a point to make?
Thanks very much, Zoe. Yeah, I mean, great presentation. Sad that we're having to look at these stats, but really informative. So thank you for sharing that. I've really come to this from a vaccine sort of interest point, because in Crawley last week, we were able to help provide the first mobile bus-based vaccination clinic, which is now doing over 100 people a day. And we're having discussions about doing more of that. I think Surrey is likely to get one next week, which might be a real boon given the news today about the South African strain that appears to be causing concern. So anyone in the health sector that has an interest in this, do feel free to give me a shout if you'd like to talk to us about it. Right. We're not looking to profit from it. It's purely just a case of covering costs, but we're really keen to help sort of shine a light through this tunnel that looks like it's going to be the cure to, or the start to return to normal life. And I just wondered, as a question, if you had any information on how far we're getting with vaccinations in East Sussex.
So that's a fantastic segue, Patrick, into Jessica Britton from CCG. Jessica, where are you there? Great.
Hi Zoe, thank you. Yes, sorry, I'll try to keep my camera on, but my broadband is sketchy this afternoon, so we'll see how it goes.
Great, thank you.
Great. So what I'll try and do is just provide a bit of an overview. And Patrick, it's lovely to meet you. I've heard about your work, and I know our vaccination teams are looking to see what creative options might be suitable and be able to be rolled out more widely. So thank you for that, and I'm sure I or others will be in touch. What I thought I'd do, Zoe, and do let us know what's going to be most helpful, is just give a bit of an overview of kind of where we are in the programme so far in terms of the national ask, and provide some information and some data about what that looks like in East Sussex. We don't yet have the data cut by district and borough, so I can't give Lewes District specific information today, but we are working on that in terms of how all of these data streams come together. And so as soon as we're able to do that, then of course we'd be really happy to share that with you as well. So as I think Rob was indicating, we're following the national guidance from the Joint Committee on Vaccinations and Immunisations in terms of the priority order in which we're vaccinating people. And there's the top 4 priority groups that I'll talk through in a moment. And in Sussex and indeed in East Sussex, we are on course to vaccinate all of those top 4 priority groups by mid-February, so over the next week or two. There's a number of ways in which that happens. People will perhaps already know that patients registered at a GP practice that are now in that grouping or eligible for a vaccine may be invited to a GP-led vaccination service, but there are also the wider vaccination centres that we have here. So the one at the Brighton Centre that actually services the whole of Sussex opened last week, and that continues to roll out, and a further vaccination centre opened in Eastbourne, should be around about now. We've had a focus on care homes in the first instance, so of course that is the priority grouping for us, and then moving through in terms of frontline health and social care workers and people aged over 80, and then moving to priority 3, which is the age 75 to 79 age group, and then priority 4, which is the 70 to 74 age group. And that is that key priority now for mid-Feb. So in terms of staff and residents in care homes, all older people's care homes in Sussex and East Sussex have had their first dose of vaccinations, with a very few exceptions where homes may have been subject to a COVID outbreak, and those vaccinations for the remaining homes have been scheduled. So we're really pleased that there's an enormous effort that has gone into ensuring that that particularly vulnerable group has now been vaccinated, or indeed received their first dose of vaccinations where that's been possible. In terms of our frontline health and social care workers, and indeed our over over 80s. The majority of health and social care workers have now received their first dose of vaccinations. And for those over 80s, in East Sussex, the figures are just over 80% now have received that vaccination. So that's really encouraging. For the 75 to 79 year old age group, the first dose of vaccination rate is around about the 40 to 45% mark, and the 70 to 74, which of course is moving down that priority category, is sitting at just over 11%. So we've really focused on care homes, people who are over 80, and frontline health and social care workers in the first instance, and are really confident that that is now almost complete. There's a range of ways in which services are working, as I say. So there are the GP-led community vaccination services, and then the larger vaccination centres. There's the roving service, which is where it's been taken into care homes, and we're now rolling out taking that into people's homes when they can't, for people that are perhaps housebound and can't attend a vaccination site themselves. And we continue to have the hospital hubs, which is where we'd initiated the programme. And now that we've got the wider services open, the hospital hubs are really now just focusing on concluding any additional appointments that are required for frontline health and care staff. So there's been an enormous effort, I think, that has gone into making sure that people can be receiving their vaccines. And I think we'd all be pleased to know that that really is kind of rolling its way through. For Lewes District, in addition to the larger vaccination sites that are available for people, there are 3 other ways that they're currently being served. So I think most people will know that GP practices have organised themselves into primary care networks. So that's the groupings of GP practices. And for Lewes District, there are 3 of these. There's the Foundry Healthcare Lewes Primary Care Network, which covers School Hill, St Andrews and River Lodge. And it's the Foundry Healthcare, sorry, it's the River Lodge premises that are currently being used as the vaccination site for those 3 practices. But people continue to have access to those larger sites as well. For Seaford, that's both of the practices in Seaford that work across with a wider group of PCNs moving into the Eastbourne area as well. There's currently the GP-led vaccination centre within Eastbourne. But what I'm really pleased to be able to share is that this weekend we were able to pilot a clinic for people that are over 80 in Seaford Health Centre, and for those at the Old School Surgery. And that was very successful and went really well. So we're hoping to learn from that, and would anticipate, as the vaccine continues to roll out, that we may be able to continue to do some of that much more locally as well as we move that forward. And then the final bit is the bit that covers the havens, which is the New Haven practices, Chapel Street, Meridian, Quayside and Row Avenue. And they're currently have their vaccination site at the Brighton racecourse. And we are working with community and voluntary providers to look at transport options. And again, it's great to have had an offer of another suggestion that we might be able to be supporting to make available more locally as well. So that's kind of a bit of a quick skip through about what we've currently got. In terms of people kind of hearing and learning about the vaccine, I mean, the key messages, as we've talked about, that have been put out is, of course, it's really important to get your vaccine when you're invited to have that, if that's possible for people. And I do recognise and understand the work that we'll all want to do if there's any reticence around receiving the vaccine or any concerns about that, although we are having a really good uptake and a really good response in relation to that. So within the primary care networks with the GP practices, people will be contacted directly by their practice to invite them when it's their turn to come and get the vaccine. But equally, more widely, there is a national mechanism now where people can be contacted by letter, and they can book themselves into the larger vaccination sites as well. So it's kind of either or of those mechanisms that are being rolled out at the moment, and I'm sure there'll be kind of continued opportunities for that as we continue to roll out the programme. So I'll stop there for a moment because I suspect there might be kind of questions or discussion that we might want to get into, but that's the high level overview, if you like, of how that's been rolling out and where we've currently got to.
Thank you, Jessica, and thanks so much for coming. And it is really quite astonishing how brilliantly the NHS is pulling together over this. I mean, I'm sure I'm sure so many of you share that view. Just to watch it in operation. I mean, this is the biggest mass vaccination we've actually ever had, right?
Yeah.
Or Rob, am I wrong about that? Is there a in our history, have we ever vaccinated at this level, at this pace? I don't think so.
I think once we are done, it will be the biggest. Obviously, the flu vaccine is a heroic effort that happens every year. There's a year's worth of planning that goes on, and the learning from the previous year's worth of planning. So for this to have been started from scratch, and when you think of the numbers involved, it's hugely impressive.
Yeah, it really is. And just Jessica, before I open up for questions, can you just clarify, in our rural areas, so Newark, Chailey, Barkham, Plumpton, what's the story there?
Do you know, that's a really good question. I'm trying to remember which service covers those, because all of those are covered. And I'm wondering, I don't know whether Adrian Bryan was on the call, whether he might know the answer to that.
Adrian is on the call and he's just quickly checking, and we'll put the answer in the chat box.
Right.
Yeah, no, thank you. Because obviously they are all covered, and I'm sure we'll be able to give you a helpful response to that any moment now.
So has anybody, this is your moment to ask questions of Jessica in terms of things that your community have raised, things that you're concerned about. Great. Emma, do you want to introduce yourself, Emma?
Yeah, hi, I'm Emma Knowledge. I'm the Deputy CEO of East Sussex Credit Union. This was actually on a complete aside. My dad lives in Chailey and he went and had his done in Hayward Heath. So there you go. That's, I know if you're on that side, on like the Wibblesfield side of Chailey, you can be going more into mid Sussex.
Thank you. Any other questions? Yeah, Penny. Do you want to introduce yourself, Penny?
I will. Good afternoon, everybody. Penny Shimmin from Sussex Community Development Association. I think absolutely an heroic effort going on. The SCDA is based in Newhaven, and there are some questions arising which you've already addressed to some degree, Jessica, which is about transport. But there has also been some issues this last week about elderly people having to queue in the rain for the vaccinations. So I think if those issues, both those issues can be addressed, I think it'll be a much happier situation for the people involved.
Thank you.
Thanks, Penny. I'd agree. So I'm sorry, I've had to turn my camera off because I think my bandwidth is struggling. No, I think that's really helpful, and I think any kind of thinking around that community transport is going to be really valuable. And as you'll appreciate, the kind of logistics of mass vaccinating people and really trying to ensure that they're not having such an uncomfortable experience, we will obviously continue to learn and build on. But a really helpful message to be getting out to people is, where possible, if they can arrive at their appointment time. Because often people obviously are kind of quite keen, or they're planning their journey, and that can be quite difficult. But the more people are able to come at the appointment time, then the smoother that also helps make it.
Jessica and I had a conversation earlier on, Penny, about the residents in Newhaven. I mean, it's just some of you will know that Newhaven is one of the places of greatest deprivation in our district, and of course places of deprivation generally have very poor access to healthcare, and it's a shame but a little bit unavoidable right now that people are having to travel to Brighton Racecourse, or I understand the Brighton Centre. I don't know if that's actually right. I have heard of people going to the Brighton Centre. So, you know, we all need to work together to see if we can find some other more local solutions as we start to roll this out. But Jessica can give you some of the complexities about why that is. So, Rob, I see you want to come in, and then Joe, and then I'll hand back to Jessica.
It was just back to your earlier question around what are the kind of helpful messages to be sharing. I think just another obvious message, but I think it's never it's always worth restating, which is for those people who haven't had the chance to have their vaccine yet. You know, we're so fortunate with the magic of vaccines that actually I'm benefiting when you're having your vaccines. So whilst the staggering of it is of course frustrating for those who aren't able to get there at the earliest, and maybe someone the same age, but because of the way that the system has worked, someone else has been able to get there first. Actually, we're all benefiting when people are going forward. So it's sort of just bringing people on that journey that if you haven't been vaccinated, actually, you're still getting a benefit. And also to say, Zoe, I've got the population pyramid whenever that is appropriate.
Okay, well, let's come back to that in a minute. Jo Harper, did you want to introduce yourself?
Hi, yes, I'm Jo Harper. I'm the head of business planning and performance at Lewes Council. I really just wanted to pick up on the transport issue to give some reassurance that the Community Hub helpline, which has been running since way back last March, has got information about all the range of community transport operators, and also basically will give, you know, a range of advice and pointers to people who are having trouble getting to their vaccination sessions. So just to let you know that it's still going. We're still on the end of the phone, answering calls. Not as many as we were earlier on, but a lot of the calls we're getting now are about vaccination. So we're trying to help where we can. And I'm going to put the number in the chat if anyone doesn't know it yet. Thanks.
Thank you, Jo. That's really helpful. I can see, Jessica, in the chat, we've got some questions about premises requirements, and also some confusion about shielded people who are shielding. I don't know if you want to make any comments, or whether or not there's anything else that you want to add before we move on, because I believe Jenny is here to talk about third sector impacts.
Thanks. So I'll just be really brief. So thank you. We have had some great offers of accommodation for vaccinations, and all of that does continue to be reviewed. So thank you very much. Part of it is ensuring that we've got enough kind of clustering, if you like, of people working together across their practices, and then where they can deliver vaccinations from, and of course continue to deliver normal general primary care services at the same time. So please don't stop offering things, but currently I think with the logistics, this is the stage that we're at, and we'll continue to kind of roll that out. In terms of some of the confusion for shielded people, great to hear they were able to get a jab eventually. Really pleased to hear that. And I guess if there's anything specific people are hearing that you'd like us to respond to, then just drop me a line at any time.
Great. And just finally, Jessica, maybe we should share up the website, because you've got a really useful website where you put the stakeholder briefing up. It's twice a week, isn't it?
Yes.
And it's a really useful, and although it's sometimes the data is Sussex wide, the news is often place based. So it's useful place so that people can share information, and we can just all be really consistent with our community going forward. So thank you. Thank you very much, Jessica. And
Candice has got there before me. I was just going to
good. Yeah, it's a really helpful place, and we know that over time the data set will get a little bit more specific, so that we'll know how well we're doing in our own district, and we'll know where there are areas of naturally there will be areas of health inequality. It's how it works. So yes, we need to be vigilant of that, and make sure that we work together to address it. Thank you so much. So shall we move on? Jenny, we asked Jenny just to share a bit about. Hello Jenny, nice to see you.
Hi.
Share a bit
about. A bit late, I had network trouble.
That's all right. I hope they're resolved. Share a little bit about the third sector, where third sector is at in this third lockdown, and then we'll widen out the discussion. I'll bring in those of you from the business community, and also police and education, and anybody else, and ourselves as a council. So Jenny, over to you.
Okay, thank you. Hello, I'm Jenny Watson from 3VA, covering Lewes District. There's a number of people here from the sector, so and obviously they are among the forefront of people or groups that have been reacting to the pandemic at its various stages. From the beginning, the sector has really, I mean, it's extraordinary how quickly during the first lockdown the sector turned around, a bit like Lewes District Council turned around to provide different services for communities and support communities through doing delivery of food and stuff. Many of those groups have carried on, but obviously the demand has shrunk over recent months as the supermarkets have come into their own and people have found their own way of getting supplies in. One or two groups are actually now turning into regular community groups, if you like, which is fantastic. So they're not just carrying on providing kind of mutual aid kind of things, they're going to carry on and be community groups in the future. The major preoccupations right at the moment during this lockdown are several-fold. A lot of groups have turned, community groups have turned to getting people to appointments. Some of those will be linked in with the community hub, where they're kind of major transport providers. But there are a number of very local community groups who probably don't want it advertised too widely, or they wouldn't be able to cope. But they're continuing to provide transport, local transport for local people. I think there's been quite a bit of concern about doing that safely. And people, we've had feedback, concerns about people who, having been told to shield or to stay self-isolate for the last 6 months or more, are now suddenly being told get in a car with somebody and go and get a vaccination. So I think some people, there has been a feedback, there's been reluctance from some people to actually kind of emerge and get vaccinated. Other big concerns are around reopening, although that has kind of faded into the background a little at the moment. We did a considerable amount of work with public health and local groups around how they could reopen services safely over the summer, and a lot of them were on the cusp of reopening when the November lockdown came, and then obviously this latest one. I think apart from clearly keeping people safe during a pandemic, I think one of the big issues that's beginning to arise, and I may be able to get some feedback from people working in health, is concerns from some groups that they know people will refuse to be vaccinated, including volunteers, and they are concerned about, you know, when they get to reopen services, what happens if they've got volunteers who refuse to be vaccinated, and what happens if they've got service users who refuse to be vaccinated? How do they make sure that they're doing the best thing in the best interests of everybody who's taking part in a group? To keep everybody safe. So I think that's one of the looming questions that is going to come for them as we move out of this lockdown. And I think also we're now beginning to we're getting the message that frontline staff within the voluntary sector are up for vaccination, which is great news, because we've got a number of people going out still delivering services during the lockdown because of the vulnerability of their service users. So it's great news that that's happening. I think there's been one or two blips where the message hasn't quite gone through, but given the complexity of the process, I'm not surprised there's been a few blips. We are keeping in contact with groups. Groups are still part of, we've got a WhatsApp group which has been going for virtually the last year, and Zoom groups, and we're kind of renewing our community network meetings. And we're actually talking to voluntary and community groups within Lewes about how they want those network meetings to continue, because one of the big opportunities that has come for us over this pandemic is, while some people are excluded because of IT, it's also allowed us to include people who might be in more rural areas who haven't been able to get to community networks when they've been held in New Haven or Lewes Town. So we want to make sure that going forward, those rural groups are able to continue to participate in networks. So we're doing a bit of a consultation with them about what kind of mix do they want going forward. A lot of groups are taking this opportunity to look at their governance. it's a bit of a quiet period for those who aren't immediately involved in pandemic response. They're looking at how they're governed, looking at robustness for the future. A lot of concern about fundraising, particularly groups that have had to stop their normal services. How do they fundraise to keep going when they've got nothing to demonstrate for the last 9 months that they've been doing? So quite a bit of concern about that, and I think groups are looking at how they, have their governance and how they organise themselves. Trustee skills, have they got the skills that are needed to take themselves forward in what are going to be challenging circumstances? And what else? I think that's mostly, a lot of concern about fundraising going forward, and how, and some organisations like charity shops really concerned about their future. Are they going to be able to continue? Because of course they not only provide an income for the charities, but they also provide a place where you can buy reasonably cheap clothes and other goods, so they provide a valuable service for the community as well. But given that a lot of volunteers are, particularly in charity shops, are in the older age group, they've had a real difficulty and a challenge with volunteers. And I think across the board, organisations have woken up to the fact that sometimes they haven't got a particular plan around their volunteers. So they've kind of taken the volunteers that have come, and they've got no succession planning either within their trustees or within their volunteers within the organisation. So some big challenges ahead for the sector, doing a brilliant job in terms of responding, as you would expect. That's one of the things that we're really good at, is just getting on with it. But some huge challenges for the future, something I'm sure we share with local businesses, small businesses.
Thank you so much, Jenny. That's really helpful. I want to move on a little bit, just if that's okay. And it's fantastic, by the way, to hear that the volunteer workforce is also going to get vaccinated as part of the rollout. So that's absolutely brilliant. And I just noted that your questions about those people who choose not to, or who can't actually have a vaccine, for whatever reason, we need to get you some public health input to think through some of those other issues, so that you can get some proper advice to give to other organisations. So I think that feels really important. Rob, I don't know whether or not you would mind picking that up outside of this conversation with Jenny and our third sector partners. That would be really great. So I'd like to move on. We've got District Inspector Ripley. Ed Ripley, some of you will know here from Sussex Police. So here, if you want to give us a little bit of an update on how are things from your perspective, that would be really helpful. And then I'm going to invite Tim Whelan to just give us a bit of an update from a council's perspective, and then perhaps we'll open it up to our business and other community leaders who are here today. So over to you, Ed.
Thanks a lot, Zoe. So I'll give an overview around crime and ASP in Lewes District, and just some of the challenges that we have faced over the past few months with the lockdowns, and just some emerging threat, harm and risks, really. So statistically, crime is reducing. I've got the recent crime stats from the Community Safety Partnership. We're around 800 less crimes since April to January this year than we were for the same period the previous year. No surprise then that antisocial behaviour has increased significantly. We're up 1,018 incidents compared to the same period last year. So I think there's a couple of reasons for this. I think in terms of crime, I think it becomes more difficult for the usual methodology, the usual methods of crime to be to be carried out. So obviously the shops are shut, licensed premises are shut. We're seeing less shoplifting incidents. We're seeing an increase perhaps in burglary, but the opportunity isn't really there. I think in terms of emerging threat, harm and risk, we're seeing an increase anecdotally in fraud. And I think that's an area that certainly going forward, there's going to be even more focus around tackling certain frauds and new emerging frauds, especially around delivery drivers, scoping premises, scoping where parcels are being left. I think, you know, it leaves people vulnerable, really. So there's going to be a bit of work around that going forward. In terms of antisocial behaviour, so our approach has been the 4 E's approach, so engage, explain, encourage, and enforce. The first lockdown period, there was little enforcement. I think at the beginning, at the start, when we first had the legislation to use, that was used and tested. I think this time round, we're more aware of what our powers are and when it's appropriate to use them. So there's been a total of 430 COVID fixed penalty notices that have been issued across East Sussex. 31 of those over the past year have been served in Lewes. And that has mainly been for house parties and people failing to comply with our direction to leave areas. What we are finding quite challenging is groups of young people congregating. When I say young people, sort of from 12 years up to 20 years in parks or in town centres. That's extremely challenging. Targeted youth support and SCDA and localised community groups are helping us to manage that. So I think it's a case of just educating and then working with the parents, and that approach is escalating on an escalating scale. So that's where we are. In terms of challenges to local areas, beauty spots, we've seen an increase in footfall, especially April to June, we saw an increase. August, a significant spike in the number of people going to these locations. Barkham Mills is one of those locations, really impact on the community around dangerous parking and around increased volume of footfall. And it's really interesting what Rob Tolfrey was saying about a spike in COVID in Seaford. Actually, that goes hand in hand with the problems that we've had along the promenade in Seaford, where I'd call it thousands of people have congregated. And if you speak to any of them, as far as they're concerned, they're adhering to the 2-metre distancing rule. But when you get that volume of people together, of course, that increases risk significantly, regardless of whether or not you're adhering to social distancing. So there are all sorts of challenges around that. I've met with Lewes District Council and with Seaford Town Council, and that's a piece of work that will be ongoing throughout the rest of the year. Local farmers have complained of increased footfall, damaging fields, damaging fences, and being quite challenging. A lot of people have been abusive towards farmers when they challenge individuals. So we're seeing increased reports of antisocial behaviour there. That's something that the rural crime team are tackling, and certainly locally, it's something that my officers are engaged with the local farm community, so that we can put a proper response in place. It's one of those that when we do patrol those areas, we don't have that footfall evidence, so we're not able to. We're quite reactive rather than being preventative around that. I think that that pretty much covers what I wanted to give you an update around today. I'll just leave you with again, the antisocial behaviour. Seahaven is the most problematic and challenging area, and 65% of incidents out of that 1,018 do relate to the Seahaven area, with the biggest spike being Seaford, followed by Newhaven, then Peacehaven. So that's, yeah, it's a bit of an overview, and if you've got any questions or want any clarity, then please ask.
Thank you, Ed. That's really kind. Is there a particular message that you want us to give, particularly to parents of young people? It's tricky, isn't it? Because we need to protect the mental health of our young people to get outside. Yeah. You know, and there's a balance to be struck, isn't there? Absolutely. And I think one of the questions which is often asked, so one of the statements which is often presented is that, well, my children are mixing with other children at school, and there's no difference between that scenario and then mixing with the same people outside of school. So, you know, it's
feeling around how we tackle this is it varies. Some people say just give a fine. I don't particularly agree with that. It's just that initial message needs to be given, and that understanding of what the differences are. So I think some messaging around that would be really, really useful.
Okay, right. Thank you very much. Has anybody got any questions for Ed? Graham, do you want to introduce yourself as well, Graham, while you're there?
Yes, hi, I'm Graham Pease. I'm chairman of Team East Sussex, vice chairman of the South East Local LEP, and chairman of the New Haven Enterprise Zone. I spend my life sitting in chairs, clearly. So slightly out of area question, Fred, but interesting to know it's repeated over here. I'm over in Rother. Big increase around us of fly tipping. Is that common experience, or is that just bad luck?
No, I would suggest that this is something the council will be able to lead on or be able to answer.
Yeah.
And I'd defer that to them.
Yeah, that's fine. Thank you. In fact, you segue really nicely. I was going to ask Tim Whelan, our Director of Service Delivery from Lewes District Council, just to give us a bit of an overview of where are we at with some of our services. And I can see Christina's got a question too, which actually Tim might be well placed if you see it in the chat box, Tim. It's about homelessness.
Okay, thank you, Zoe, and good afternoon, everyone. If I pick up that fly tipping point first, Graham, yes, we've seen an increase, especially in Q1 and Q2 of fly tipping. And some say that might be correlated with the initial shutdown of the household waste sites, although they are open now. And in Q3, in Lewes District, we have seen a reduction this quarter compared to the first 2 quarters. But it is more across Lewes District than previously, yes, indeed. I'll pick up the question from Christina in a minute, but if I just go through some of the stuff we've been helping residents and business recover with. Obviously, the government has given us a number of business grants to administer. It started off with business rate relief for all hospitality, leisure and retail businesses, of which we administered £20 million worth of rate relief to those businesses. Since then, we've had 9 other schemes we've had to administer. Quite confusing for ourselves and business, but those schemes have totaled. The latest one is for the latest lockdown that went live on the 15th of January. We have a portal that does quite a lot of automated approvals on those applications, and we have seen 572 applications since the 15th of January, and we've approved 550. Which means we paid out £4,158,000 to local businesses in those 2-week period. Most businesses who are approved, they get paid within 3 to 4 working days of going through our portal. So it's really progressing that at speed because we understand the need for that money to get to local business. In total, the team have administered 1,620 individual grants for local businesses. So at the moment, on top of the £20 million business rate relief, we've administered £5,719,495 to Lewes businesses. It's an incredible piece of work that, if you think that started in March and we're still administering schemes now a year later. I was reflecting my heads of service 31st of January last year. The World Health Organization did the global emergency about the pandemic. We went away this week last year and made sure our business continuity plans could hold up to such a pandemic, which I'm glad to say they have on all essential services. But you would never think that a year later we'd still be in the situation when we're working within those continuity plans. And we've seen a large increase in applications for housing benefit, as you would imagine in these times. It's between 30 to 50% increase on demand on this time last year per month. There's a national target to process new claims in 21 days, and our teams, which I'll remind everyone, all our teams from March 23rd have mainly worked from home. Everyone who can work from home can, including our customer advisors. We're now processing new claims in 16 days, under the target of 21 days. And when people give us change of circumstances, which impacts on the amount of money they get in housing benefit, we're processing them in 5 rather than 8 days. So that's something that we need to resource into next year. We think that demand will increase in that area, housing benefit area, and council tax collection will increase over the next year. And another thing the government's asked us to implement is the track and trace payments. So this is a £500 payment made to anyone on low income or on job seekers or universal credit who are told to self-isolate through track and trace. We were averaging pre-Christmas about 25 a week. Since Christmas, it's 130 a week. And looking at the data this morning, we had 63 last weekend alone. We've paid out £47,500 to people to ensure that they self-isolate, and we will continue. That's been extended now. It's meant to end on the 31st of January, and that's been extended to the 31st of March. So we will continue making those payments and receive top-up funding from the government if we need to. As we've alluded to around supermarkets, we have environmental health specialists who are working closely with those businesses to help them stay open and ensure that they're doing everything they can to protect customers and staff. And we've looked at their COVID capacity and ensure numbers have been monitored at the door and ensure they have all the sanitation in place. So that's quite a large piece of work. They're averaging, as Rob said, we get common data from public health, and our environmental health specialists will go out and visit those premises to ensure that they're doing everything they can to stay open in a COVID secure way. Joe Harper's alluded to our work about the Community Hub and the Customer Contact Centre, and an essential life piece to a number of our residents and businesses. The Community Hub is starting to see an increase since Christmas. We're averaging about 80 to 90 calls a week, and we're using staff from places like our Tourist Information Centre to bolster our teams to help with that. Our call centre remains really busy, and the staff are working from home. Just to give you some perspective, since December, that team have taken 17,600 calls, and they're answering them in an average of 28 seconds, which is against what was a historically quite a testing target of 60 seconds. So the team there are doing really well. It has helped by the fact we've seen quite a shift to digital contact. So since Christmas, we've had over 8,000 emails and done over 4,000 web chats. And interestingly, 39 of our processes were started by customers online in January. So for us, that digital shift is really important because it allows us to resource our phone lines for those customers who are digitally excluded and for those really vulnerable customers who need our urgent support. So the more people that are able to contact us digitally and the better we can do with that contact, the more resource we have for the more vulnerable customers. Another part that we really had to look at for what we have to deliver is our housing function. There's some really crucial functions in housing. We've seen an increase, about a 12% increase in the numbers of people presenting as homelessness or threat of homelessness. Since December, we've had 65 people or families present as a risk of homelessness. Of those 65, we've only placed 7 in emergency accommodation because we don't think that is an acceptable accommodation, especially during these times. And I'm really pleased to say that at the end of December, we only had 31 households in emergency accommodation in Lewes District. That's down from 45 at the end of September 2020 and a peak of 61 at the end of June 19. So for the team to deliver those results for those people in emergency accommodation is a fantastic achievement in these present times that we live in. We had a big concern, as I mentioned, about those business continuity plans, about our retirement housing stock. Obviously, we needed to make that as COVID secure as possible, so we put in numerous measures in March last year, which still continue. We've not had any clusters or spikes of infections amongst these potentially vulnerable tenants, and we've only had 1 case in our retirement stock to date. So really pleased how those COVID securities have gone. We obviously have really concern with rough sleeping during this pandemic. We have a winter provision which runs to the 31st of March, which anyone can access. At present in Lewes, we have 8 people in that winter provision, and we have 3 people refusing accommodation, although our outreach teams are still working directly with them to try and convince them that the winter provision is the best way forward. Once they're in that winter provision, we're able to work with our partners to work with those to hopefully move them on to next steps accommodation, so that we can use this as an opportunity, if there is an opportunity in such a thing as COVID, that we can get people that are former rough sleepers and move them into more secure tenancies. So we're working closely with partners to achieve that. In tenancy management, as Ed said, we've seen an increase in ASB, and our teams are working closely with our partners on dealing with that. We have an excellent partnership relationship with Sussex Police on ASB, and it really pays dividend within our own housing stock. And before I stop for any questions, I can't say anything but praise for our waste team. So our waste team, despite the new strain having a much larger impact on our team than in the first wave, this new strain has definitely had a bigger impact. The plans we have in place has meant that we are able to maintain all waste services and all street cleansing services. And I think it's something, from all the cards that are left on bins, it's something the public really appreciate, that the sign that the local authority is on top of everything they need to do. So the team, they've been working really hard. It's been more of a challenge, as I say, this last couple of weeks, with more people having to self-isolate. But as I say, the plans have held up well. And I'm just full of praise for all the teams that have delivered in service delivery over the last year. I've got nothing but praise for everyone. But I'm happy to stop there and take any questions.
Thank you so much, Tim. I've got echo. Anybody else got echo? Ah, thank you. So thanks very much, Tim. And I know that lots of residents are really grateful for the support that they've been provided. Has anybody got any questions? I can see that Belinda's got a comment. I don't think it's a question. And Christina also. Christina, Belinda, did you want to say something? Do you want to introduce yourself?
Hi, thanks, Zoe. Yeah, Belinda Crawford. I'm with Lewes Open Door, and we work with the homeless and the vulnerable here in Lewes. And I know that lots of you know that it's an ongoing situation with the homeless not taking up emergency accommodation or taking up the offer. And I think a lot of you on the council also know that it's because it's not available in Lewes. And hopefully we can work with you and with Katie Dawkins and people like that to make sure there is something that could be nearer to home. Some of them do work from time to time, or have casual labour jobs which are in Lewes, and it's impossible for them to manage that and going to Eastbourne, as well as having their community and often family ties here in Lewes. So it's an ongoing situation that we would really like to, at the very beginning of these whole discussions, we talked about repurposing council premises, and this is one of our hopes and dreams. I mean, we're working out of a car park at the moment to be able to support the homeless community, and we really need somewhere where we can offer them facilities for washing, as well as being able to feed washing, and also being able to access the other services they need, like for their alcohol dependency and drug dependency and things like that, which I know are now happening in some of the places in Eastbourne. So it'd be great to be able to do that in Lewes.
Thanks,
absolutely, Belinda. Sorry, Zoe.
No, carry on, Tim.
Yeah, absolutely, and we are constantly looking for properties suitable for lease in Lewes District that we can use for that type of accommodation. We've received funding from Homes England for some more property, which has been match funded by Right to Buy. So absolutely, would be looking at any property that we can find in Lewes District.
Great, thank you. Christina, did you want to come in?
Yeah, that probably dovetails into what I was asking, which is about the number of people that Brighton have moved into Lewes and Newhaven. Because if we haven't got spaces in Lewes for our own homeless, then why are Brighton putting their homeless into Lewes? I know it's quite close, but we believe that Tim's team have actually found placements available in Brighton, and yet they're still putting them into Lewes and Newhaven. So I wondered if, first of all, whether Tim had anything to say about that, and also whether Ed has found any problems with the people that have been moved in from Brighton.
Thank you, Christina. Tim.
Thank you, Christina. With regards to the emergency accommodation, we don't want to use emergency accommodation for former rough sleepers. We want to rent units where they can have that, as Belinda said, that care wrapped around them. Emergency accommodation is offered in places like Newhaven and Peacehaven, but as you can see from our figures, it's our desire not to place people into emergency accommodation. We'd rather place people into temporary accommodation. So we're just not using those service providers in where you've mentioned, Christina, because we've only got 31 people in emergency accommodation, and we're using our own council stock to place people in temporary accommodation, because that's a much securer tenancy if they are homeless. And so that allows those people whose business model is to offer nightly paid accommodation to not just Brighton and Hove Council. You get offered to the Justice Department, you get offered to the probation, and you get it offered to a number of different public sectors who have that need. But for a Lewes perspective, we don't want to place people in emergency accommodation. We think it should be as emergency accommodation. If that night you need it, then we put you in it, and then we find you temporary accommodation to give you a bit more secure tenancy. We are, as you know from Eastbourne, there's probably, there is, from the data this morning, there's 112 out of area placements in Lewes District from Brighton and Hove, and there's 200 in Eastbourne. As I say, it's a symptom of the businesses offering that type of provision to public sectors that use them. We are dealing, myself and Rob and Zoe and other people are having those conversations with Brighton around out of area placements and about how they're going to use their Next Steps funding, which they received after London, they've received the highest Next Steps funding of any council, including Liverpool and Manchester. So we're having those conversations now, Christina, and we'll keep you updated how they go.
I think the thing to say from my perspective on this is that our biggest concern is actually about the safety and support that those people receive, and whether or not that is adequate and well thought out and well planned with all the other agencies. I think that's the big issue. So we're in discussions about how to make sure that does happen and it happens well. So shall we, I'd like to move on, if that's all right with everybody, to just hear a little bit from our business community representatives who are here. So, you know, we've got Christina with her Chambers of Commerce hat on, we've got Graham, I've seen we've got Kay Crittle. Just, do you want to get perhaps chip in a little bit with what are we hearing from our business community about impact of this third lockdown? Would be really useful for us all to hear, I think. I don't know who wants to have a go.
It's no trouble for me to offer Christina because she's more on the streets than me.
Oh, great, and I can see Ian. Yeah,
but I'm happy to comment later.
Okay.
Thanks, Graham. Yeah, I was going to suggest that Susan Murray might want to speak on behalf of Lewes Chamber of Commerce and the Lewes Pound. Susan, are you still there?
Yes, I'm still here.
Do you want to tell everyone how you see it from your point of view?
Yeah, I mean, the Lewes Pound, in the beginning, we found it really difficult because people were very wary of taking actual pieces of paper money. But that particular fear seems to have gone away quite a lot, and we're finding that quite a lot of businesses and, you know, shops as well as the markets are happy to take pieces of paper money again. So the Lewes Pound has started functioning again really well, which is great in terms of helping to support local independent businesses. So from that point of view, we're really pleased with the way it's gone. As for the wider Chamber of Commerce, we've actually got a meeting tomorrow morning, so it's kind of back to front. I mean, I could probably report back afterwards, but
thank you.
Yeah.
Okay, thank you very much. So I see we've also got Ian Smallwood from East Sussex County Council. Hi, Ian. Hi.
Hi.
Do come in.
Thank you. I'd just like to give you sort of a bit of an understanding of what the Growth Hub team have been doing to support businesses over, well, the last 10 months or so. Overall, they've supported more than 1,000 businesses in that time, which is 3.5–4 times more than they would have done in a whole year previously. It's a very small team. There's myself and up until recently 1.5 navigators. So They've been incredibly busy. Interesting comments about lockdown 2.0 or whatever it was called back in November. Had very little impact. We were sort of building ourselves up for another massive spike in inquiries, and it didn't happen. It's very strange businesses' reaction to that. Lockdown 3.0, we got the spike again. The vast majority of the inquiries are around finance. And yeah, I do want to pay tribute to the guys in the local councils who've been administering those rates grants and similar grants. They have done an incredible job. The downside is government announce these things, these support measures, and then work out how the heck to do it. And that's understandable. You know, it's the opposite way around to what we're used to. But there's an awful lot of expectation management that the team have been doing. As soon as something's announced, emails start coming in, telephone starts ringing, and expecting an answer straight away. And we know that's not possible, but actually managing those expectations of those businesses who are now becoming desperate for money.
Okay.
The amount of support that has been provided to them has tailed off over time. It was great to start with, 25,000 grants, etc. But it's now becoming almost a three-piece problem. So it's that survival piece, keeping your business going, keeping the staff on board, and businesses are now saying that they're having to make some pretty hard decisions, because once furlough finishes, they may not be able to keep those staff on.
Okay.
There's the recovery phase. How are they positioning themselves for recovery? And many of them aren't. And then I hate to use another horrible phrase, but EU exit will impact on those businesses. It will be a double whammy. It's not a good place to be for some businesses. There is one small piece of two pieces of positivity. There are still some brilliant businesses out there which are doing some really good stuff, and they're keeping plugging away, and they will get through.
Okay.
There's some businesses that won't. Because economic activity is reduced at the moment, the shops are shut, some of the manufacturing businesses are closed down or working on limited hours, they're not reliant on the imports. The shops haven't stocked up on imported goods, the businesses aren't importing fruit and veg and raw materials. So a lot of that impact of EU exit is going to be delayed. So it will kick in some months down the line, and hopefully those businesses are going to be more robust. But it is, for the businesses, all around finance. It's finding the money to keep going.
Okay, thank you very much, Ian. Christina and Graham, did you want to contribute at this point, or anybody else for that matter, actually?
Yeah, I'd like to step in if I can. Graham, you go first. You've got your hand up.
I was just going to say that the feedback to me, which is much wider and much broader than Ian's, but therefore in some ways much less useful and a bit more waffly, is that particularly in the hospitality and visitor economy sector, businesses are clinging on by their fingernails. They're ploughing through their savings. Government helps, and again, congratulations to all local authorities involved for distributing them. But they might just make it through. At LEP level, we're asking for government just to try to do a little bit better to help them through, because with a bit of luck, it's not a very long wait until they can start bringing their businesses back. I think, however, there's going to be a real frightener for the county. At the moment, I think I'm right in saying, now hang on, is that across the county? No, it is in Hastings, but probably equivalent somewhere else. There are 20,000, no, it's the county, I'm sorry. There are 20,000 unemployed and there are 40,000 on furlough. When furloughing stops, that's going to be a rather disturbing statistic, and we're all extremely worried about that. But there's optimism. There are people who are trying. There are businesses that are succeeding, and we just need to keep them going and keep them struggling with a little bit more government help. Easy to say, not easy to do if you're one of the businesses at the very sharp end. Christina.
Absolutely. I agree with Graham that the hospitality businesses are just hanging on by their fingernails. What didn't help was before Christmas, the hospitality businesses that were put into tier 4 were given so little notice that a lot of them had actually ordered and paid for and bought all their food for Christmas, and then suddenly it was just wasted and just gone. And that's a lot of money. You know, the average pub spends £10,000-20,000 at that time of year on buying stock for Christmas, and that was wasted. So those hospitality businesses are just about hanging on. There is a real it's very difficult to keep people's heads up at the moment. There's a real feeling of, oh God, have I got to do this again? I've had enough. You know, I've been running my business for 30 years, and these are even businesses that have been extremely successful. They're now actually looking at themselves and thinking, why do I bother? Why am I doing this? And I think we will see a lot of people who will actually retire because they can't face rebuilding it again. So I do think that as Graham said, that 40,000 on furlough may well move into unemployment. I hope not, but I've got a nasty feeling that there will be a huge spike in unemployment. What we're doing as a chamber and also as an enterprise agency is we've managed to get funding for free support for unemployed people, because if they've had a small payout, the last thing they want to do is waste that on starting a new business if it doesn't stack up. So we're giving people startup support across East Sussex, as will Ian be from the Growth Hub. And this is fully funded by the councils and by the ERDF. So if you do hear of anyone who's been made redundant, push them in our direction. I'll put a link in the chat, but do encourage them to speak to us. Also, any businesses that are thinking of closing, get them to speak to us. We'll help them make the decision, and we'll help them close or sell their business and do the minimum damage to their savings. There's also lots of support available. We've got 35 consultants who specialise in different areas, and they can all be made available free of charge. So if any businesses need help, then contact us, contact BES Growth Hub, and we will help them make the right decision for them and also make it happen with minimal damage, or help them to turn the business around, find a new business model, find a new route to market, help them understand social media better. You know, whatever it is they need, we're very flexible. We can give them what they need, and we can create the support bespoke to them. So it might be just 2 hours. They want one-to-one with a social media expert. It might be 12 hours support they want. It might be a whole program, 18-hour support. So we can work it according to whatever they need.
Thank you. Thank you, Christina. Christina, would you mind muting? Oh, thank you. Kay, did you want to come in just while you're unmuting yourself? One of the key purposes of this kind of forum of us coming together, in my mind, is for us to be able to spot things that are going to occur. It's like we're about to walk off of a cliff edge, are we not, of the furlough scheme? And you know, I know already that. I'm sure I know this and I haven't made it up, that Plumpton and the NHS have been working together on a hospitality to health transformation. If you think about our economy in Lewes District, you know, the NHS plus the education sector are some of the biggest employers alongside local government. So it makes sense for us to be working together to you know, really support those people who are going to need to change career, you know, avoid redundancy, you know, work together. So I think it would be worth us having a bit of a conversation, or at least some of the right people having a bit of a conversation about extending some of that at some pace, and that we think ahead about what's going to happen to our community. Great. Thanks for that, Christina. So Kay, do you want to come in?
I thought I'd just give you something a little bit more on the detail level, on a smaller level, as what's going on in the centre, because there's some good news, a little bit of good news in there. A little bit like Ian was saying, first lockdown, we, you know, we lost some tenants. Some of them just because they couldn't afford it any longer, because you know, they'd lost their income completely. So there was a move on from there. But nothing really happened in the second lockdown, you know, with people working remotely, but nothing really from the second lockdown. So it's very similar to what Ian was saying here. But now we are starting to see more inquiries, and we've got new tenants coming in, we've got new businesses coming in, people that perhaps would previously been commuting outside and are now actually looking at working closer to home, which is a positive bit. And we've got some positives because we've got parking. People don't have to use public transport. So we are starting to see a bit of an uplift and some optimism throughout our tenants. We, a bit like others, we offer them a lot of support, and out there with business support, pointing them to the right direction with funding, finance, help maybe with social media. So we've been able to give them help with their marketing and how they actually look perhaps when we're coming out of this pandemic. So not quite as bad, to be honest with you. Lockdown 3, I thought we were going to have some more issues, but actually it seems to be maybe plateauing and starting to move up slightly. But I do agree with everyone, the furlough, that does concern me. I think we are going to have a lot to deal with then, and I think a lot of people where in actual fact maybe starting up necessity businesses is going to be the way to go.
Thank you.
Which could work for us actually, as a, you know, and other co-working space could actually work as a positive.
Yeah, thank you very much for that, Kay. So are there any other contributions that anybody else wants to make? Graham, I see you've still got your hand up. Is that a legacy hand or no,
it's a fresh hand. I'm not quite sure what the description of a new hand is. Anyways, new hand. Just really make the point, following on from Kay's comments, that indeed there is still very considerable unsatisfied demand for B1 industrial. This is at a rather larger scale than Kay's talking about, B1 industrial and warehousing. So local authority and planning colleagues, if you can in any way enable the bringing forward of that sort of space, there is unmet demand here for people to expand their businesses, grow their businesses, start businesses, move down here businesses and provide jobs. So please help.
Thank you.
I speak to Ian Fitzpatrick about this regularly, don't worry.
Yeah, good.
Thank
you. Thank you very much. Kay, you've got your hand up. Is that or is that okay?
I think that's a legacy one. I'll take it down. But I do agree with Graham, what Graham was saying. There is definitely an unmet demand out there.
Okay, and I've got a question for, just before we wind up. Obviously I haven't travelled about the district recently, so I've only seen what's been going on my high street, outside of, you know, literally the 200 yards outside of my front door. So I've got a bit of a question for some of our town council presence here. So I've noticed that in Lewes, particularly at the top of town, I think we've lost 7 out of, I don't know, I counted the other day, it was 7 out of 20 shops, some of which were empty before COVID, 2 of which were empty before COVID, but 5 weren't. I'm wondering what Seaford, Peacehaven, Newhaven town, you know, high streets or the equivalent of is looking like at the moment, just to give us a bit of a sense of what's happening. If anybody's noticed anything massively different, or is it just it's a Lewes centric issue? feel free to just unmute yourselves and chip in from my town council colleagues. Or don't rush. No, don't rush. It's fine. Hi, this is Tony, isn't it?
Yes, good afternoon, everybody. Tony Allen here, clerk at Peacehaven Town Council. I think generally, and we do work with our colleagues, and we are a member of the Chamber of Commerce, because essentially we are a business of some sort. Yes, many people struggling to provide takeaway services or delivery services where they can. Otherwise, just like most towns, mostly closed down. I just want to quickly mention something, slightly digressing, if that's okay, because we were talking about money and funding, and the same applies to town councils, of course. And we've become aware of situations where local groups, community interest groups, charities, small organisations have kind of fallen through the net a bit, whereby they're not able to take advantage of any of the various grants that are available. Now, we're lucky to be in a position where we have a small fund of money, so we're launching an emergency community grant scheme for Peacehaven groups, simply to try and help them survive. And it could be any type of group, even a small Scouts group, Cubs group, anything, and bigger than that, just so that when we do hopefully come out the other side of all this, just a small effort from us, we might be able to make sure that they still exist. So thank you. I just wanted to mention that. Great.
Thank you very much, Tony. I see. Christina, did you want to come in?
Yes, I just wanted to add that someone else that's sort of fallen between the cracks is the small independent butchers, bakers, candlestick makers, who, the greengrocers, who are spread out throughout the town. And the footfall is so low that although they're still open and they're selling essential goods, they are struggling to make the sort of income they would normally make because the footfall is so low. And I just wanted to mention them so that we don't forget them.
Yeah.
So they are struggling on, they are staying open, but they're just not seeing the people because there's no one working around them and there's no one walking around them.
Yeah, so Peter's just reminded us, he's put in the chat all the different eat local, shop local, make local websites trying to connect people to businesses that we've established. It would be really great if you would share all of those across your networks. I know so many of you do already, but like Christina's saying, those that are still open, we really need to support them. Great. So I can see there's lots of sharing of different grants and other resources in the chat box. Thank you so much. So the purpose of this session was to, yes, quite right, Graham, absolutely. The purpose of this session was to bring together us all as, I like to think of us all as community leaders in our own different ways, to see where we're at and to maybe think about anticipating what comes next. So I hope that that's kind of met people's, that it's been useful. It would be useful to have a bit of a sense in the chat about how useful that's been, and also whether or not we want to consider maybe, I feel particularly concerned about the end of furlough and whether a group of public sector and community sector anchors, or organisations want to come together with representatives in the business community to start to think about which sectors might need a bit more support in the next phase as furlough comes to an end. That would be really great, and I don't know if those people are particularly interested in NHS County Council colleagues, but also our business sector colleagues. Oh, and I've forgotten about Rob. Rob, do you want to put up your slides? Are you still there? Hey, I'm so sorry.
Yes, no problem at all.
Let's have a look. Just a lot. Let's wrap us up with a last bit of data for the data.
A little bit of data. Poor you being dragged through data by a public health consultant, but that is my duty. So I will just pull up. Let's see if this works. So this is the population pyramid. Can you see that, Zoe? Has that come through?
Yeah.
So this is just showing the age standardized rates, so accounting for the population and making it comparable. So what we're seeing in Lewes is fairly typical, that we are seeing cases across all ages, that actually young people, so the sort of the under 20s are forming really quite a small proportion. We've seen that sort of generally has been the case. We haven't seen the sort of peak of cases in schools, as a lot of people have maybe thought that may be driving this. Really, the focus is working age, but as you can see, we're kind of seeing a fairly even spread across all, but with particularly the 30s to 70-year-olds being the largest proportion, and of course 20 to 29 as well. We do see that distribution, and we've seen this again right across East Sussex, of more cases amongst females compared to males. Speaking as a man, I don't know whether this is in some way reflecting less health-seeking behaviour in men, which is sometimes the case, but maybe easy to over assume. But that's the pattern of the last 2 weeks. So cases right across the age groups, but focused on working age.
Thank you very much. So a few people have reminded me of a few things that we've left out. So we haven't reported back on the survey that we did. Perhaps we should do that next time. Also,
I like Graham's point there about all the caring. Well, absolutely. We know that a large proportion of the care sector is staffed by women who are paid poorly, and who are accessing a lot of testing through this. So you're absolutely right. I would expect that to be explaining part of that working age distribution. Thanks, Graham.
Yeah, but very point well made. So I'm going to suggest that we. I also saw a useful comment from Josie about the education sector. Of course, need to be thinking about coming end of furlough and avoiding cliff edge for certain sectors in our community. So what I'm going to suggest is that we close here. Thank you so much, everybody, for coming. Thank you for those people who shared their SITREP updates. Thank you to Rob, Jenny, Jessica, Tim, Ed and others for sharing what you know, and let's perhaps gather in a couple of months' time. In the meantime, I think it would be useful for us to do a little bit of thinking together about end of furlough and particular sectors that are going to be affected, and we bring the public sector together with others to think that through. Thank you so much, and have a good evening, and see you in a few months' time. Thank you.